right, let's get started. Thanks for tuning in today. You're watching All Walks of Life, and today we are here with Nicole. Nicole, how you doing today?
I'm doing good.
Good. How many siblings do you have, and where'd you grow up at?
I have a younger brother, 2.5 years younger, and I grew up in Plain City, Ohio.
How was your childhood like growing up?
Yeah, my childhood was a very, very loving household, but very, very dysfunctional. My dad, he drank a lot. He was able to go to work, get off work, go through the drive-thru, grab some beer, and then he would drink until, the wee hours of the morning. And my mom was kind of the same way. She's an addict, so alcoholic as well. She would drink pretty heavily as well, and a lot of fighting, that kind of a thing. So I didn't go one day without my parents telling me they loved me. So I knew that my parents loved me, but it was just very dysfunctional.
So it seemed like you had a pretty good childhood, but there's also problems as well. Okay.
Yeah,
So growing up like that, having both parents addicted, did that have an impact and effect on you growing up?
Absolutely. It was one of those things where at a very, very young age, I had to grow up. 7 or 8 years old, I can remember going into my dad's room and making sure that he didn't fall asleep with a cigarette in his hand, the house didn't burn down, holding my mom's hair if she was around the toilet puking, or helping take care of my younger brother.
Now, as you're seeing this as a kid, did you know that that your parents were addicts, or is it just something that you, since you're young, you thought this is life, like this is what everyone's parents do, this is what every kid does, they take care of their parents? Was it normal to you, or did you know that something was off?
I totally thought that was normal. I thought that everybody's life was like that. So later on in life, obviously, like I know now that that's really not normal, but at the time, it was just everyday life for us.
So take us down the journey then, high school for you. How was your life like? What did you do in high school? Did you end up going down the path that your parents went down, or seeing them drinking and you taking care of them your whole childhood, did that make you stray away from that?
I always promised myself that I would not be like that. And, a lot of parents are always telling their kids, like, do as I say, not as I do. I want you to be better than me. And I had that mentality growing up. I was such a backwards kid. I had significant mental health at a very young age, so I grew up with that lack of self-confidence or that self-esteem. Always felt like there was something wrong with me. I did not know how to form relationships. I never had friends up until I was about in middle school, so very backwards, very, very shy, and could never handle my emotions very well. I was into self-harming at a very young age too.
Is that how you coped with all that then?
Yeah. I started drinking. I had my first drink when I was 12, and then I started using other things as well as drinking pretty often when I was about 14. Yeah.
Can you elaborate on the other things you started doing?
Smoking weed.
Smoking weed?
Smoking marijuana.
Smoking marijuana, okay.
Yeah, I didn't go any further than that.
Now, did you stay doing that, like, let's say your whole high school and after high school? Or?
Pretty much, yeah. And it was like more of on occasion because I hated it. I hated the taste of, marijuana. I hated the taste of alcohol, but I liked how it made me feel. I was able to numb and escape reality. I was very much an escape I was an escape reality person. Like I still am to this day. Really struggle with staying in the moment and living my life. I love to go into like imagination land and to do all that, so that's how it was like for me a lot.
You did these things to make you feel numb, and you got addicted to feeling numb. Take us down that journey. Where did that being addicted to feeling numb, not having to feel the pain of your reality of the things that you're going through in your day-to-day life, where did that take you down? Take us on that journey.
I think that I was an addict before I ever started using drugs, so along the journey, man, I, would do anything to numb myself, whether that was food, whether that was anorexic or bulimia, if that was harming myself. It was always something I would do to numb myself. And then along the way, I found my drug of choice, which was benzos and opiates. So, and of course, I just totally lost my train of thought.
That's watching benzos. That's a type of pill.
Yes.
Okay. Well, what is
Anxiety
that for?
medication.
Anxiety. Okay.
Yeah.
Where did that take you down?
Oh, an awful road.
Awful road.
An awful road.
Did you just how did you do the pills? I know there's different ways to do it. Did you just swallow it? Did you crush it and snort them? How did you take your drug of choice?
I would swallow them. I mean, and just always varied too. I mean, either way, a drug is a drug is a drug, no matter how you use it. But I found it more effective, and I promised myself always that I would never do this, I would never do that, and everything I just started doing, so all of those things that I promised myself I would never do, I was end up doing it. Like, I promised myself I would never use through IV.
You said you started that at age 14?
Yeah, I started drinking and doing marijuana when I was
14. How old were you when you first took your first pill?
I took my very first pill around like 16, but I did not become dependent on them until I was about, I want to say 20.
So for about 4 years you were taking them. Was it just like a couple times a month, or since you said you weren't addicted to them yet,
Right.
How often would you take
Not
these?
Very often. I was drinking more than anything, but even then, I felt like I was more of that functioning, if you want to say, you know what I'm saying? It was just more of like a here and there kind of a thing. Even with the pills, it was just like a here and there thing.
So then take us on the journey of what got you from a here and there, just an average here and there user to an addict. Because there's a big difference between people that, if someone just drinks a beer like once a month, well, they're not an alcoholic. But if you're going to be, let's say a 12-pack every day,
Right.
out all day long every month, that's an alcoholic right there. So you said from age 16 to 20, you were like an often user. What turned you into an addict? What turned you into an active user? Take us on that journey.
Well, I consider myself that I have always been like that, regardless. Like I said, I've always used something, but like as far as like with my drug of choice, it was about when I was like 20 years old, where I just had my daughter, and I was prescribed medication because of the procedure that I had with her when I gave birth, and I loved it. I loved it. I loved how good it made me feel. Like, it made me into a very confident person. It numbed my pain and it made me feel good, So.
Your confidence, was it a good confidence? Did it turn you confident in a good way, or did it turn you confident into almost like a cocky and arrogant? You thought you were the shit, but maybe your vision was blurred because of the drug of choice that you were doing. So was it a good confidence, or was it like an arrogance?
I thought it was a good confidence, but honestly, looking back on it now, it was a very much a cocky, I'm the shit kind of a person.
We were talking earlier off camera, and you were telling me that you got put into a treatment program. At what age did you get put into that program, and what actions did you take that made you be placed into this program?
I was working in a nursing home for a couple years, and once I had my daughter, I was actually back at the nursing home because I went to the hospital and got fired from there because of my addiction. And when I went back to the nursing home, I was in full-blown addiction, And one night I had this amazing thought that the disease of addiction gives to us. And it was like, man, you know how to get into that med cart, girl. You know, why don't you grab in and get what you want? And it wasn't even, So I went into the med cart and I thought I walked out with 50 pills. Turns out I walked out with like over 200. And they were like narcotics, benzos, all kinds of stuff. Like, wow, I even walked out with like heart medication. Oh, wow. It just was grab and go. Yeah, and
you didn't know what you were taking.
No.
All pills, boom, gimme.
Yep, pretty much. That's how it was. It was pure addict behavior, impulse.
Now, was that a one-time thing and then you got busted and they caught you in the program, or was that something that you did regularly, or even maybe like, I don't know, once a month, or how often did you do that?
You know, I would always steal from people, but as far as like with that setting, was stealing from the facility, it was just a one-time thing. I had this thought, I grabbed as many as I could because I was going to go, when I go out, I go balls to the wall. It's all or nothing for me. There's no gray, there's black and white, and usually I go hard, you know.
How they busted you, how you got caught?
I was busted that morning. You know, like I acted so stupid and they were like, oh my God, what happened? Because they do Met count every single morning. And, you know, I was still there. And I think about that sometimes of like, why did you stick around? Why didn't you just leave? You know, but I get in.
You took the pills,
Yeah.
You stayed at your job like to finish your shift?
Yes.
Oh, wow.
Yeah.
What did you do with all them pills? You said what, 200?
Yeah.
Plus two? What did you do with them all?
I would always like socialize before the beginning of my use with other people, and towards the end of my use I was an isolator, so like there was no sharing with you. Like I'm using by myself, you're lucky if you get any. So I sold some, but I mostly kept them all for myself.
Did someone tell on you, or how did you get busted? How did they know that you took them?
It was me.
They knew because of how I was acting that morning. I was high when, you know, they all came in for first shift, you know, because I worked third at the time. So they all came in and, you know, they saw me and they just were kind of like, you know, what's going on? And then all the meds are gone. They just kind of put two and two together. So.
All right, so you went to court. You said he didn't put you in the program right away. As long as you don't mess up. What happened?
About a year in, I was working at the hospital and history repeated itself. So I will share this story real quick because this is like pure moment where I knew that looking back, the level of powerlessness that an addict really has. I had a patient who was very combative and very out of her mind, and she was in there for back surgery. So they went to go take her to the restroom, and I remember I was changing her sheets, and there was pills on her bed. So I grabbed them, and I was like, I'm gonna go look these up and look what they are. And she had oxycodone, and one of them was all coated like chalky, like it's been in her mouth. Oh, okay. I didn't give a shit. I just popped it. And that's when I knew, like, oh man, like I don't even care if this has even been in her mouth, dude. Like that's a problem.
And did you just take that?
Yeah.
Or did she have more and you pocketed them, or?
No, but that started it.
That started it. And then you went down a road.
I went down a road stealing from patients again. Actually got caught by a couple of them, and that's when that turning point of like, you know, they asked me, you know, did you do it? I denied, and they actually believed me. They believed me, but I was just so blown in my addiction again, picked up right where I left off because I had been clean for about a year. And so when that happened, I just went ahead and quit because I was just too unfunctional to even work.
You said you've been clean for almost a year. For the audience and the viewers that's watching it, because I know a lot of people have questions, like especially for like cigarettes, when a woman stops smoking a cigarette when she's pregnant for 9 months, and then like I know when my mom a couple of different times after my brother or sister, she'd pick up again. And I always wondered in my head, like, if you can quit for 9 months, like, why do you start again? You know, like, it's out of your system, things like that. Now it's just mental mentality. How was that? If you was clean for a whole year, what made you go back down that road?
A big part of it, like that I've learned today, because I've relapsed quite a few times, and with the work that I'm doing on myself in the 12-step program that I'm in now, I know that I don't have to use, and I am learning tools and new ways to live. I didn't know a way to live back then. Even while I was abstinent and not using drugs, I did not know how to live properly as normal people would do. So that for me, like a need to escape reality and, the way that I portrayed things in life was just no way for an adult to be handling them, with feelings and everything.
You said earlier you had a daughter. Is that your only child, or how many children do you have?
I have two. I have an almost 11-year-old and an 8-year-old, but my boyfriend has two as well. And I've pretty much taken over that mom role. Their mom is not in their life, so they're my two as well.
You were talking to me earlier about when you were a child and your parents were both alcoholics and drinking, and you would take care of your mom. You would check on your dad in the middle of the night and make sure he was breathing. I'm gonna throw a twist at you real quick. Did you think about about your kids, and did you put yourself and your children in your situation, how you as a kid taking care of your parents, now you as an adult, a parent yourself, you have this addiction to these pills? Tell us your mindset on that. Did you see your kids and see yourself in your kids? Oh, wow, my kids are taking care of me. They're taking care of mommy. Or did that not even cross your mind? Did it have any emotions? Or did the addiction just overtake your mind and your body so much to where looking at your kids, you couldn't even tell or realize, like, what am I doing? I'm doing the same things my parents did. Like, my kids are taking care of me. I took care of my parents. And then in that process, did that make you think in your head or in your mind at all about maybe, since now you did that with your parents, and then later on in life stuff happened and you became an addict and addicted to pills, did that ever cross your head into maybe the stuff that, I don't want to say you put your kids through, but in reality, you put your kids through, I don't want to sugarcoat it either. Did it ever make you feel like, wow, what am I doing? Like, am I setting my kids up for a road because they see me go through this? Or tell us about your emotions and what's going through your head as your kids are taking care of you.
Well, my kids were so little at the time. When I was using very, very heavily, me and their dad just were so toxic for each other. We were both so immature, and he's using, I am using, so they didn't really know at the time. Now, my mentality and my feelings about it, looking back, then at that moment, I did not care. It was that thing where I was going to do what I had to do. My addiction was more important, and now looking back, it's just, I feel the guilt and shame now than what I did then. But at the time, excuse me.
Were you and your kids' father together for?
To almost 10 years.
Wow. Yeah. After you don't have to get in detail about how you guys broke up and stuff, but was it because what was one of the reasons, or you don't have to even tell a reason, but what was like a situation to where you guys kind of fell off? Because 10 years, that's to be with someone. That's a long time to be with someone.
And like I'm not going to talk shit about him, because he has his own life, and he, I'm sure that he has his own demons that he battles with, you know what I mean? But I know for me and him, it just was so toxic, and wasn't happy, and I was with him since I was 15, and I felt like I had to be with him because he was my kid's dad, you know. And it was always that manipulation of feeling sorry for me and this and that, and so I felt obligated to stay, you know, because I was just so scared of what would happen. So, you know, having the courage to be able to leave. And plus it was just like a lot of fighting, a lot of verbal and mental abuse on both of our parts to each other. And it was just so toxic, you know, but I'd been with him since I was 15, you know, so that's all I knew, you know, so.
Take us down the path, take us on your journey, the road you were on after you told us about how you got into the program. And then almost 8 months later, you relapsed and you got high again. Take us on that journey from you're clean for 8 months, you relapse, you get high. Where does Nicole go from there?
Okay. So, yeah, I mean, I had a probation violation, so I was sentenced to treatment for 8 months. And I hated it. I hated every single moment of that treatment center, and I resented it for a very, very long time until recently. And I know that today that I was just so broken, and I wanted to tell people what they wanted to hear. I was not willing to do the work on myself, and so I got nothing out of it. It was just one of those things where I was clean, but still inside I was just so broken. I did not know how to manage my emotions or anything. So I got, you know, in there, stayed for 8 months, got out, moved here to Bell Fountain with my ex and my kids, you know, and I was living the dream, man. Like, I was still clean. I was coming to 12-step meetings, you know, and I got a good job. I was a peer support here in Bell Fountain at Family Treatment Court. You know, I was helping other people. I had like a bunch of sponsees and a bunch of peers that I worked with.
What took you down into helping others, and what took you down the road into getting into this 12-step program? Because that court ordered, this 12-step program?
No, that was not court ordered. I felt like I've been to meetings before. I've been to different 12-step programs before. And I saw it work for some people, but it was just like I never put in the work, you know, so I thought it was going to work itself for me, if that makes sense.
Yeah. How long from when you got out of that treatment program? You said you were in there for 8 months, and then how long was it before you relapsed again?
I was about 8 months on the outside clean until I relapsed.
From when you relapsed that second time after being clean, getting on the outside, how long was it before you started helping these girls you were talking about and taking these 12-step programs almost immediately? So you didn't continue to use after you relapsed. That was your relapse, and then you was able to take these programs? Or
well, I got out of treatment, and then almost immediately I was able to get the job and start, and then I ended up leaving my ex, and you know, I was coming to 12-step meetings and doing my thing, and the biggest thing for me was that it was self-seeking because I built up my ego. You know, that's what it was about, and I know we talked about that before.
So it sounds like you're doing it for the right reasons, but then yet again for the wrong reasons.
Exactly.
Instead of really trying to heal, you're trying to make yourself, you're pretty much trying, it sounds like you're trying to make the lifestyle that you're doing fit you. Like, yes, you're taking a 12-step programs, but you just said it's for yourself, it's for ego, it's to make you feel better. So I kind of hear, and what I'm sensing from is like it's to get better and to get clean. But if you don't get clean, you can still tell yourself, I took this program. I'm not saying better, but you're pretty much saying I'm better because I took this program. So in a way, it's like a little bit arrogant or cocky. It's not
Exactly. A very much self-centered thing. It was more of like that image of that reputation that, well, look at me, look what I'm doing, you know, and the fact that I can help them. You know, they lean on me for support. Yeah. They lean on me to help work their program, you know.
To stay clean then the whole time, from after your last relapse up until now? Or you said you left your ex, and how did you get with the man you're with today?
Well, me and him actually met when I was in treatment. I was on a furlough and I came here for a 12-step meeting, and he was there, and he was actually chairing the meeting that night. And we, we said hi and that kind of a thing. But then I started coming to more 12-step meetings.
All right, so you're in the middle of helping these people out. You're with the man you're with today. You were talking to me earlier off camera about that you ended up relapsing again.
Yeah.
And you were trying to lie to this man, but because he's in programs and stuff as well, he knew you were pretty much bullshitting him.
Yeah.
Take us on that journey.
Okay. Well, I was on that point where I felt like that my cure was in a medicine bottle, so again, I get into this denial thing of thinking that I'm not an addict, or, that nothing's wrong with me. It's everything else, right? So I ended up going to my doctor and asking her, for medication. She ended up prescribing me my drug of choice, Klonopins. And so I remember telling my boyfriend, that I needed help with these because I was scared of going down that hill. And he was like, okay, well, I got you. We're going to hide them. And then we say this thing in my program of one's too many and 1,000's never enough. So I took one, and I unleashed the beast of addiction. So I just started going ham, and I found them. I took those, and then I started stealing from people.
How long from the last time you relapsed, you got clean, you're helping all these women out, helping all these people that need help? You just told us you relapsed again. How long was that from the last relapse to this relapse?
It was probably about 2.5 months. Yeah, because I relapsed in November of 2018, like around Thanksgiving, and then I got clean January 30th of 2019.
Now, is this the very last time that you relapsed?
Yes, this was the previous one that I just came out of, yeah.
Take us on that journey. What happened from the last time you relapsed, because you relapsed again, and from what you talked to me earlier, you've been clean ever since this last relapse. How long has that been?
That's almost been 3 years.
Almost
In
3
January
years.
it'll be 3 years.
Take us on that journey onto where this seems like a record for you. 3
It's
years
a hell of a
almost.
journey. Yeah.
It seems like you're doing incredible, amazing journey. You're helping all these people. Take us on that journey from the last relapse, Nicole, to this Nicole.
Okay. So, yeah, I ended up using, but I had to keep this image, right? I had to keep this reputation in the rooms. And, some people will say that, like, it's the program, it doesn't work. No, it does work. I just wasn't working it. The problem was me. So, I would come to meetings high. I would be with my peers and sponsees high. I had to hide it.
Peers and sponsees know that you were high?
No, not at the time. I mean, I don't think they knew. I had a pretty good, job to cover that. At first, I did a pretty good job, but then towards the end, it started to show itself because I just started getting, spiraling down more and more and more. And it got to the point where it was just not hideable anymore. So
Continue on with that. Keep that in mind. Keep that fresh in your brain. It's just popped in my head, so I want to ask it while it's still fresh in my brain. Mm-hmm. You're someone taking these 12-step program. You're helping these people out. So as a former addict myself, and you being a former addict, let's try and put our brains and our thought process in these people that you are helping. Okay. As an addict, if let's say, so we're trusting you, right? We're trusting, and you're trusting yourself. You're trusting this person that's trying to help you. She's been through it. She's been where you've been at, been down something similar as you. If they found out that you're still getting high, coming in to high, what do you think, that could, I don't know the question I'm trying to ask, but how would you let's go from there. How would you feel like it's someone that it's almost if you're a Christian and you believe in Jesus and you kind of find out Jesus was not real, or just everything he told you was just a bullshit lie.
Right.
You would look at Jesus crazy. Like, you put your whole trust in this, you would never believe in anything again, you know?
Absolutely.
So if these people come to find out that you're lying to them, did you ever feel like, wow, you're hurting them more than helping them? Even though you think you're helping them, you're pretty much hurting them in a way, because if you're still getting high and these people are looking at you for help, like this lady has been through what I've been through. I want to be like her. She's kicked this addiction's ass. She's looking, she's clean. She's helping us out. I can get there.
Right.
But if they come find out that you're not who you say you are, you're lying. You know, like, it's almost like if your favorite celebrity. A lot of times they tell you don't want to meet your celebrities in real life because your expectations will get let down. You know, they're not like who you think they are.
And that's how it was. You know, that was my mentality on it.
You think like you could have hurt all these people, like maybe it could have almost, like, not saying ended their life, but ended their chances of getting clean because they put all your hope and all their faith in you, and you're just letting them down, getting high.
Listen.
About that, or is it just something like, oh wow, that was
I did after I got clean. But at the time it was, you got to keep up this image. You got to keep up this image, you know. So I was maintaining my addiction, but at the same time I was portraying like I was clean, you know, and that I was living clean. Like, it was so crazy because I would tell them my disease of like, man, like, you should get high. But I would say, oh no, I'm not using, you know. But I'm going home and I'm popping pills. Right. You know what I mean? I was living in a lie. And my fear was that everyone was going to see that I was a fraud, or that I was fake, or, you know, that I was going to let everybody down. And with my sponsees and peers in particular, when I did get clean and I came out that I was clean and got my white key tag, you know, it was... I thought for a long, long time that a lot of people stopped coming to meetings and stopped coming to, you know, the 12-step program was because of me and what I did. You know, from me using and getting high, you know, it really messed a lot of people up. So that was a big, big fear of mine too. Absolutely.
All right, so we are at the point to where you were talking to me earlier off camera about your boyfriend. You're still getting high. You're trying to hide it from everyone. You're doing pretty good at it from what it sounds like. But your boyfriend knows you're lying.
Yeah. Yeah.
Take us from there.
Okay, so actually it was a friend that called me out at first. It all happened on the same day. He called me and he was like, Nicole, I know you're fucking up. You know, we need to do something. I cussed him out. Then his sponsor calls me and says the same thing. I cuss him out, whatever. And then I get over to my sponsee's house and I'm trying to get a hold of my boyfriend, and it's just, you know, he's being kind of short with me. He knows something's going on. So I'm like, well, I'm going to go to a meeting where he's at and I'm going to tell him about himself. So I get there and he knows that something's wrong. He's kind of looking at me and he's just like, okay, it's time to go home. Takes me home. And I'm slurring. I think that I'm really hiding it, right? That's how we are. We think we're hiding it, but we're not. And he was just like, I know you're using. I know you're getting high. And I remember I denied, and then I was like, you know, this is not okay. And I remember I started crying and I went down to the floor. It was just like, you know, I fucked up, you know, but I really thought that my relationship was done, everything was done. And instead of, you know, yelling at me or fighting with me or breaking up with me, you know, he got on the floor with me. And he cried with me, and he was like, okay, well, do you need to go to treatment? And I was like, no, I don't want to go back. And he's like, okay, well, then tomorrow we're going to go do something about it. We're going to go to a meeting, and you're going to get honest. So
tomorrow comes?
Tomorrow comes. I'm very emotional that day. I'll never, ever fucking forget this day. I went to a meeting, and I started crying to my sponsees and told her what was going on. And then at the meeting, I went and got my 24-hour key tag, and it was in front of everybody and their mom, all my sponsees, all my peers, everybody. And you know, it was one of the most humbling experiences of my life.
And have you been clean ever since?
I have been clean ever
How long has
since.
that been?
Almost 3 years.
Congratulations, that's
Thank you.
awesome.
Thank you.
So to end this, tell us what life is like for Nicole. You're clean almost 3 years. You've been through hell and back. Life took you to rock bottom, took you in the gutter, in the trenches, drug you through the mud. You're clean, sober, 3 years almost. How is life like for Nicole today? What is life like for you today?
You know, it's been a really, really hard road, and it's still hard. You know, one of the biggest things that I can say is that if it was not for the loving God that I have invited into my life and my 12-step program, I would not be here. I would not be clean. Hell knows if I would be alive. You know, it's been a really, really hard journey. It's not easy by any means. People think that when you get clean, it's going to be all butterflies and rainbows and pancakes, but that's just not how it is. Life on life's terms happens, and it's happened for me. You know, like we were talking before, I have 4 kids and 2 of them have severe autism. You know, so there's been a lot of times where I've questioned my sanity. There's been a lot of times where I've harmed myself physically because I have significant mental health as well. You know, I've had to do so much hard work with step work and my sponsorship and service and with other people in the 12-step program I'm in. And I really, really had to do some hard soul searching. There we go. And I'm still doing it, man. Like, it's not a ride where you graduate from.
Right.
I don't
Yeah, once you
graduate from this.
feel like once you know you're an addict, you're always a recovering addict. Like you're always going to be.
I'm still an addict. I
you know.
just choose to be in recovery. Today.
Yeah, exactly. Yep. I saw a post online that said something about a recovered addict, and I always just feel like that was misplaced because it's like you can recover, but you're always recovering. You know,
Yes.
like you know anyone could always relapse. You know, something could happen to where you could relapse. So you're always recovering from it. You're not fully. At least I don't personally believe someone's fully recovered because there's that you know void in life to where you could relapse again, you know.
Right.
So you're always recovering.
Absolutely. You know, and the journey is just beginning for me. You know, I've learned that having 3 years clean, that's great, you know, but it ain't shit. It's like the moment that I think I know everything is the moment I find out I know absolutely nothing.
Right. Oh, that's very, very well put.
Yeah.
Well, it seems like you're doing really good though. You know, you're helping people
But
out.
I'm making it.
It's hard, but you're making it. Amen. You're still doing the 12-step programs.
Yes.
And that's awesome because I know some people don't, you know, after like let's say a year or two, I'm a recovering drug addict, but I don't need to take these meetings anymore because I don't have the urge to drink or, you know, do cocaine or do drugs or shoot up or, you know, eat McDonald's every day or whatever drug of choice. Because I personally believe people tend to forget that like fast food and stuff like that is drugs. It's like, that's still anything that's an addiction like that. It could, you know, it'll take whirlpools on people's lives.
Right.
So yeah, is there any goals and aspirations for you that you're working towards?
I'm a stay-at-home mom, you know, so my life is my kids, my life is recovery. You know, I would say my biggest goal right now is obviously to get to 3 years clean. That would be great. And just, you know, being still and being happy. You know, my version of happy is so much more different than other people's. Mine is just staying at home with my PJs and watching movies and,
Awesome.
you know, just being a better person, I think is the biggest thing. Like right now, my disease is really manifesting in my anger. You know, so I really just want to work on my anger so that way I can have a better peace of mind and just kind of, you know what I'm trying to say? Like just be a better person with that.
To end this episode, before, if there's any advice you want to give to anyone or anyone listening, and if you want to give a message to any of them, before we go there, I know earlier I asked you when you told me that you were helping these people out before you got clean. You were clean, but before you relapsed your last time, to where we went and talked a little bit about how you felt knowing that you were helping these people, but you were still being high, and how I was asking you, like, if what would happen if they found out about that, like their whole world could shatter, or just like, you're there for this person. Now you are clean and sober, almost 3 years, and you are helping these people. How does that make you feel now? Because it's like, it's not the same situation, but it almost is. But except this time you're not lying to yourself. You are clean, you are sober, you're being truthful to these guys. Now it's not, you don't have anything to hide. As in before, when you were telling them whatever you were telling them, or whatever you did in the meetings to them, they thought you were clean and sober, so whatever you said to them, they took that too hard, or however people take advice or guidance like that, whatever they do with it, they did whatever they did with it. But you were lying to them, so I could see how that could like affect you in a way. How does that affect you now, knowing that like that's not you anymore? Like now you're doing it and it's legit. You're not going home getting high anymore. You're really helping these people. You're not half helping these people. Because I look at it like you was helping them, but you weren't helping them. You were like half helping them. You're lying to them. You were almost telling them what they wanted to hear. Because how can you help someone if you can't even help yourself? Like how are you going to help these people when you're with an addiction, when you're going home and getting high yourself? Right. You can't tell someone to put something down when you're just going to pick that up as soon as you get home.
I think the biggest thing for me today is that it's not even about me. It's about, there's a power greater than me that comes from two addicts or more sitting together and helping each other.
Did you see how you said it's not about you?
Yeah.
And earlier,
it's a change in perspective, I'm telling you.
Your emotions.
Yeah.
You did the stuff all for you.
Yeah, and before it was all about me, and I still go through moments, don't get me wrong, where I'm thinking like, well, what about me? And then it's like, I'm really quick today to get out of that. Yeah. It's like, it's about selfless service. Like when, we talked and it was like, just being able to sit down and help people. If my experience helps other people, then that's great. It's about helping other sick addicts who I was just like, that thought, man, like I don't know how to live anymore. I don't want to do this anymore. And I guess with the piece of advice too that I would say is just, that
was my next question. If there's any advice for anyone watching this out here that may be going through something similar that you went through, or it don't even have to be addiction, It could have been someone that's been in prison. It could have been someone that's just lost everything in their life and they're homeless. It could be someone that lost a child. It could be someone that maybe had a house fire. Anything. It could be someone, that just like some bad shit's happened to them, So it don't have to be just for strictly addicts. Is there any advice you want to give to anyone out there watching this? That's why I named this All Walks of Life. It's for all. It's for everyone. All walks of life.
Everybody's path is different, and I would just say that first of all, there's hope. Hold on, pain ends, baby. And that's something that I learned very on in the beginning. That hold on, pain ends. That's what hope stands for me. And you no longer have to live this way anymore. There is hope, and you can get help. And for the addicts that are out there specifically, the lie's dead, we do recover. That's my favorite quote out of our piece of literature is that, we do recover, because it's like people in society may think that once a junkie, always a junkie, but I'm beating the stigma just for today is that we can recover.
Yep, and I feel like that's a big thing for people. That this is another reason why I'm doing this series, to help people. I love that quote, helping people help people, is because I feel like a lot of people, they hold back and they don't get it off their chest. They don't tell their story, all because of how you just said, they don't want to be labeled as a drug addict or an addict the rest of their life. But we do recover.
My label
people
does
do
not
recover.
Define me.
Amen. Exactly.
It does not define who I am. I am proud to say that I'm a recovering addict. Like, look, I'll be talking to a pastor. I that's actually just happened to me about a year ago. I was wearing 12-step shirt, and he was like, "Are you from that program?" And I said, "Yeah." And he's like, "Oh my gosh!" And I'm like, "Yep, I am a proud recovering addict, man." Like,
Yep. Alrighty, well that's all the time that we have for today. So Nicole, thank you for coming on All Walks of Life and telling your story. Is there any final advice or messages you would like to give out there to anyone watching this?
if nobody's told you they loved you today, please know that I do.
Awesome, awesome. Well, thank you for coming on, and once again, congratulations on the almost 3 years. Thank you for being a part of this series and telling your story.
Absolutely. Thank you so much for having me.
Thank you, thank you. All right, everybody else, thank you for tuning in. Thank you for listening. Thank you for checking out the series. Have a good day and God bless.